yes, the state's ultimate function is security and defence, and it's important that the state has a monopoly of violence. We don't want to, we learned from the Wagner situation that you don't really want to really rely on private forces. But in terms of the other services, you can there is the option to bring in other types of providers, and what's enabled me to advocate defence whilst in ensuring that overall public spending is kept at a sensible level is that I'm perfectly willing to explore other options in terms of the delivery of healthcare, free at the point of use.
You mean the private sector, do you, Chris?
Sorry?
You mean the private sector, do you?
The private sector, the charitable sector as well. I'd even look at it in terms of education as well. Again, free at the point of use, but I don't see why it has to be the state that ultimately delivers the services.
Do you know what the answer to that is, Chris? The answer to that I will give to you right now, and I've rehearsed it many times on the TV interviews that I've done about what I think should happen to the NHS, is because every time you use the private sector, every time the NHS uses the private sector, so yeah, it's free to the point of use to the patient. But each time that the NHS uses the private sector, it further undermines the NHS as a public service. And so actually, it's not, from my point of view at least, it's not really helping the NHS. If it's plugging gaps, then let's properly plug those gaps by properly funding the NHS, which is going back to my point earlier on. And so I think actually, anytime the NHS uses the private sector to plug those gaps, it's just an admission of failure that the NHS itself isn't sufficiently funded to be able to do that work without the use of the private sector.